Hello everyone and welcome to my YouTube channel Med School Learning. Today I'll be delving into an important topic that every aspiring medical professional should have a strong understanding of the common disease of kidney. In this video, I'll be discussing the causes, symptoms, and prevention strategies of all the diseases of kidney. Whether you are a medical student or just someone interested in learning more about healthcare, this information will be valuable. So, let's get started. So, here is the content of the video. What topics we will be discussing in the entire video. Here are some. So, first is the introduction, glomerulonephritis, nephrotic syndrome, acute renal failure, chronic renal failure, and the last one is dialysis. So students, let's start with the introduction. There are nearly 70 million people with kidney disease of varying severity levels in India. Hypertension and diabetes are the main causative factors. Each kidney is composed of 1 million functional units called nephrons, and each nephron is consist of a glomerulus, which is a tuft of capillaries invaginated into an epithelial sac called as Bowman's capsule, from which arises a tubule. Blood flow through kidney is large, amounting 130 ml per minute, which is about 1/4 of the cardiac output at rest. The filtrate formed in the glomerulus is at a rate of 100 ml per minute, passes first into the proximal convoluted tubule, which is also commonly known as PCT, and from there through the loop of Henle and distal convoluted tubule, also in short it is known as DCT, to the collecting duct. Blood constitutes which pass into the glomerular capsule are water, mineral, salts, amino acids, keto acids, glucose, hormones, urea, uric acid, toxins, and drugs. So now let's move to our next slide of biochemical assessment of renal function. Before going to study the key points, I would like to explain you what is biochemical assessment. It is basically referred to as the detection of number of nutrients stored or depleted from the body fluids. It is known as biochemical assessment. So the first point in this slide is measurement of plasma concentration of urea, creatinine, sodium, potassium, bicarbonate, calcium, inorganic phosphate, and alkaline phosphate. The upper limit of serum creatinine is 1.4 mg per 100 ml for the males, whereas 1.3 mg per 100 ml for females. Creatinine is excreted completely by glomeruli, which I have already explained you all in the introductory slide. As there is no tubular absorption, estimation of serum creatinine gives a good indicator of GFR, which is also known as glomerular filtration rate. GFR can be measured by creatinine clearance. The normal clearance level is 125 ml per minute. When kidney fails, GFR would be less than 30 ml per minute. So the formula of GFR is UV divided by P. U stands for creatinine concentration in urine, whereas V stands for volume of urine excreted in 1 minute, and the P stands for creatinine concentration in plasma. The normal GFR is about 100 to 125 ml per minute per 1.73 meter square. So let's move to our next slide for more biochemical assessment key points. So here is Potassium and phosphate level increases in plasma, and bicarbonate concentration also increases when there is a kidney failure. So while assessing the biochemical parameters, we have to look all the electrolytes, whether they are increasing or decreasing, because they are the good indicators for kidney functioning, assessment of kidney functioning. And the next point is renal dysfunction increases the alkaline phosphatase as vitamin D synthesis is affected. Volume of urine is also affected. It may be increased, decreased, or remain normal at different stages of acute and chronic renal failure. So students, please tell me by doing comments, what do you understand by the word acute and the chronic? And if you have a query, then later on few slides I'll be explaining you about the word acute and chronic renal failure in detail. Next point is abnormal urinary constituents like blood and protein may be present in the urine when kidney fails to function. And the last point of the slide is in the disorder of renal tubules, excess loss of sodium and potassium or magnesium can also occur. So students, I am ending this video with this topic, and stay tuned for the part 2 of the video in which I'll be explaining you all about glomerulonephritis, its clinical symptoms, principles of dietary management. Till then, keep revising, and if you like my content, please do like, share and comment. Thank you so much. Take care and have a nice day.